osteopathically trained manual physical therapist, and I want to give you some insight into what our goals are medically for when we give you homework, when we give you exercises or stretches to do. What are we really after? One of the hardest things to do when somebody comes in complaining of something, typically pain, is that everybody wants to treat the pain. So the pain's here, and we got to do something about the pain. The problem is that where the pain shows up and where the origin are two separate places. Pain is often opposite of dysfunction. The problem with this, though, is that there are two parts to your nervous system that report pain. You can get pain fibers over your normal body wall fibers, right? And you'll say, well, yeah, but I feel it here, so it's got to be the body wall. That's not true. What happens is your sympathetic nervous system actually picks up nociception, which is deemed pain in your brain. And so that nociception will actually come in on these low sensitivity fibers from structures that are other than your body wall. Like instead of just your muscles, it's coming from your capsule, or coming from a ligament, or coming from an organ, coming from the bag around your lungs or heart. For example, think about a heart attack and how people can have everything from jaw pain to neck pain, shoulder pain, even down into elbow pain. So what happens is that sensation will come in on these sympathetic nerves, and then when it gets to the spinal cord, it jumps to the other nerves. And then it makes you feel like, oh, so for example, I'm having a gallbladder attack, or I'm having a gallbladder attack, right? So, or I'm having a heart attack, or I'm having a heart attack. So it depends on where that information is coming in and what it means. So when we give you homework, that's so that we can have you test out what we think is causing it. And so we need you to do your stretches, usually stretches. Now everybody wants to do strengthening exercises, and the problem being is that the biggest cause of problems, the most often seen problem, is lack of range of motion. Lack of range of motion on one side leads to pain on the other, because you get hypermobility here and you get hypomobility there. So when we, for example, when we give you stretches and exercises, we want you to stretch the structure we're after. So for example, hamstring stretches, you may have even been instructed to do this by a healthcare provider, like straighten your knee and come down and stretch. And then you'll get a large pull behind your knee. We're not after stretching your tendons and ligaments, or at least if that causes your pain, then we'll know it's the tendons or ligaments. Ideally, you would bend your knee about 15 to 20 degrees, square yourself up, and then arch your low back and come down so that you feel that stretch in the mid-belly, in the muscle. Because if we actually think that it's your muscle, we want you to stretch the muscle belly, right? So there's a tendon, a muscle belly, and a tendon. And so if we focus all that stretch here in the back of the knee, you're not going to stretch your tendons. They don't stretch. The muscle is maybe where you have a chance to at least reset the fibers and reset the stretch receptors and change the tension in that hamstring, for example. So when you do your homework, please do it appropriately. And make sure you ask a question. Do you want that stretch in the muscle, or do you want that stretch in the tendon? Again, because this also feeds back to what structures are we after. I need to know, is that something that has sympathetic feed, or is that something that has just body wall feed? Because again, the sympathetic will come all the way back to the spinal cord, jump onto the body wall, and make you think that it's body wall problem. But we need to separate those out. So keep that in mind.